Hello, my name is Annette. I have CF and I had a double lung transplant 6 years ago. Welcome to my channel. Hi guys, it's Annette here. I wanted to introduce you to my dog. This is Bella. She's a little bit camera shy, but very, very sweet. I'd love to know if you guys have any pets. I find that she really helps me when I'm having a hard time with anything really, not just my health, but just any kind of life issues that come up. I find that just being with her, her sweet energy, her just her loving nature really, it's really sweet, and I can't imagine my life without a dog, to be honest. Anyway, so today I actually wanted to do my meds with you. I know that there's a lot of questions and concerns out there as far as post-transplant meds, and I did a video that kind of was botched. I'm sorry about that. I did re-upload the video, but anyway, I talked a little bit about how I handle side effects from medications. Luckily, right now they're at a minimum, so thank God we're doing okay. So I wanted to just prepare my meds with you and talk a little bit about what I take and why I take it. So this very first one, this is a very big bottle, and it is called tacrolimus, and these come in 1 and 5 milligram pills, and I think there's also half. So I'm gonna show it up close to you. Let me see if I can get this in my fingers. So that's the pill, that's what it looks like. It's very small, and I actually take 2 pills twice a day. So I'm gonna put 2 pills in here, and I like to use the cap as a little pill cup. And most of them, I think all of my pills come with these kinds of caps, so whichever one I happen to take out first, that's the one that becomes the pill cap for me, or the pill cup for me. Anyway, so I'm just gonna hold this here between my legs with my knees, hopefully not spilling. I have spilled meds before, so it's not pretty. And so before I get started, I just wanted to show you guys, I keep my meds in a bag, and I don't take all of these every day, so I'll explain to you how that works. But I keep these in a bag because it's just easy that way. When I go away for the weekend, I tend to travel pretty frequently, just driving up and down the coast, visiting family and such. So it's just easy to grab it, stick it in a backpack or a suitcase, and I'm gone, as opposed to keeping them in a cabinet where each time I have to bring them out. Another thing I have to say is I do not believe in counting pills. I know some people put pills into those pill boxes, and they do it for a week in advance, and I know that works for a lot of people. It doesn't work for me for many reasons, which is why I keep them all like this. And I did go to Hawaii a few months ago, and I did take all of my medications. I did not count pills because I tend to count wrong. And so before transplant, when I was dealing with mostly CF pills, there have been times when I would miscount and I would not have enough enzymes, or I would not have enough of a certain antibiotic, and it was just really stressful. And so I can't afford to do that now. I've talked before where CF pills, if you skip, depending on how severe you are in your disease and depending on what the pill is, nothing bad will really happen. Not so with transplant pills, and I don't trust myself to count. So I absolutely bring all of my pills with me all the time, no matter where I go. And I always make sure if I am going to be traveling somewhere far, like for example, when I went to Hawaii, I like to bring extra pills with me just to be on the safe side, especially if I'm low on some pills. Anyway, that being said, this is how I keep my pills in a bag, and when the bag rips, as it has ripped a little bit here, I just get another bag, and you can just get these from the grocery store. Like this is like what you would put fruits or veggies in. Anyway, okay, so I'm gonna put this down here so that you guys can have a clear, nice view of Bells. I call her Bells or Bella, or yeah, she has a lot of nicknames. Anyway, all right, so the next medication, oh, so I forgot to mention, the tacrolimus is an anti-rejection pill, and it is pretty much across the board. I think, don't quote me on this, but I'm pretty sure that all transplant patients take this regardless of which organ, but I know for sure that all lung transplant patients take tacrolimus. And the dose varies because they have to, it's based on your level in your blood, so they have to draw your blood, and based on the level, that is how they adjust it. One of the reasons why patients have to see the transplant doctor a lot after transplant, like right after transplant, is because they're trying to get the dosage right. So you have to get blood drawn frequently, and then once they figure out the dose, then you don't have to go quite as often. For me personally, it took about 2 weeks once I was out of the hospital, because this medication, the Tacro, is affected by the fat content of your food. So depending on how high your fat intake is, will actually vary the dose. So you want to try to be fairly consistent, and they usually say to take it on an empty stomach. I sometimes take it on an empty stomach, sometimes I don't. But again, the most important thing is if you eat something, make sure it's low in fat, or wait at least 2 hours after or 1 hour before when you take the Tacro. Anyway, going on to the next pill. The Tacro is a very important medication, hence why I've spent so much time on it. The next one is called metoprolol. And the metoprolol is actually a blood pressure medication. And so not everyone, but there are some patients, including like myself, CF patients, who post-transplant develop high blood pressure. It's actually a side effect of some of the medications that you take. Unfortunately, you can't just stop taking the meds, so the way to deal with it is to add more meds. And so I take metoprolol twice a day, also just one pill, and it's a very small one. I'll show it to you. It's a pink one, and there it is. I hope this is okay. Good, it's not blurring out. Okay, so that's the metoprolol, and I take that pill twice a day. I already put one in my cup, that's why I put it back. Okay, so the next medicine is called gabapentin. And gabapentin is something that I think, well, I was on it right after transplant, but as I've said, I am 6 years post-transplant, but there have been some issues with pain, not necessarily with chest pain or anything. My chest has completely healed since transplant, but you can still have residual nerve pain, which is what gabapentin is for. It's for nerve pain. I've developed a little bit of pain in my leg and my hip area. So in addition to doing some physical therapy, I'm also taking gabapentin. And right now I take 4 a day. I'm sorry, no, 4 twice a day. And it's only just 4 milligrams, so it's not that much. It just sounds like a lot because of the quantity of the pills. So, and the gabapentin is actually very similar in size and color to the tacrolimus. So I have to be very careful when I take my meds to make sure that I'm taking the right med in the right dose, in the right quantity. And I also take these twice a day. And so these 3 medications, the Tacro, the metoprolol, and the gabapentin, I take twice a day. I take it in the morning or somewhere in the early afternoon area, and I also take it at night right before bed. It's good to have at least about 12 hours between doses. Sometimes I do a little cheat and I do 10 hours if I took it late, or if I have to take it early for some reason. But I try to keep about 10 to 12 hours between doses for these 3 medications. All the other medications, with the exception, actually, let me do this one, biotin. Now, biotin is for hair, for skin. It's just good overall to take biotin. These are 5,000 mcg. I'm not entirely sure what mcg stands for, probably microcubic grams. Yeah, probably not. Anyway, I take 1 twice a day. And if you would like to know specifically why I take them, first of all, some medications like Tacro can actually thin your hair, and that was happening to me. So I started taking biotin, and I think it has helped. And furthermore, it's just a good thing to have. So I take biotin twice a day. Okay, so then these 4 pills, I will try to show you these up close. Yeah, if you can see them right there. I take twice a day, and these are my staples. Take them every day, twice a day, no matter what. Moving on. All right, let me see what I got here. Prednisone. Now, everybody is on a different dose of prednisone. I take 5 milligrams every other day. And so the way that I've been able to remember when to take it, because there have been times when from day to day I can't remember if I took it the day before or if I need to take it today. What I do is I take them on even days. So today is the 17th of July, so I will not take prednisone today. Now, a good question is, well, what if there are 2 odd days in a row? For example, July 31st, which is coming up, and August 1st. They're both odd days. I have talked to my transplant team about that, and they said that, you know, one day doesn't really matter. It's really the fact that you continuously take it. However, I feel kind of bad. I don't know what my body will do if it doesn't have it. So I actually choose to take half of a prednisone on one of those days. Usually I'll take it on the 2nd odd day, just to kind of tide me over until the next even day. So today, no prednisone. Okay, then we've got, let's see what we've got. I took that one already. Okay, sulfa. So this is basically Bactrim. Every CF patient probably has heard of Bactrim. You might even be on Bactrim or have taken Bactrim in the past. Yes, I do take Bactrim still. It is one of those CF meds that you just kind of continue on taking. However, Bactrim is more of a preventative as opposed to something that is actively being treated. So I take Bactrim 3 times a week, depending on how far you are out of transplant. You might be taking it more frequently. So I take it 3 times a week, and I take it on specific days to remember what days. And there's another medication that I take 3 times a week, and I like to stagger them. I've heard that a lot of transplant patients like to take them together so they don't forget. But I like to stagger them because I like to take as few medications as possible. So this one is a Tuesday, Thursday, Saturday medicine, and today is actually Wednesday. So once again, no Bactrim today. All right, the next one is valganciclovir. Talk about a mouthful. So the valganciclovir, I will show you, looks like this. And it's probably about the size of a Bactrim, maybe a little bit longer and a little skinnier, I don't know. It's not too big of a pill. And so the valganciclovir I take every day. It's a daily medication that I take with my morning pills. And it is actually an antifungal medicine. I was on it originally as a preventative, and now I'm on it because of, what's that thing called? I forget what it's called now. But it's an antiviral, so it's good for any kind of virus prevention or virus treatment for that matter. And when I remember the name of it, I will make sure to post it in the comments. I might have to look it up actually. Anyway, so valganciclovir every day. And then azathioprine. Azathioprine is another anti-rejection medication. And I know that some people take it in addition to other transplant medicines, which is something I do, but I actually also take it instead of a medicine. I started off taking Cellcept. A lot of patients post-transplant are started on tacrolimus, Cellcept, prednisone, and then perhaps azathioprine is added to it. I, however, was allergic to the Cellcept. It was killing the lining of my large intestine. If you are thinking about transplant or if you are currently on Cellcept, don't worry. It's about a 1 in a million chance that that'll happen to you. But it happened to me, and they actually had to do a colonoscopy to figure out what was going on because I was having horrible stomach pains for the first about 6 to 8 months after transplant. Anyway, so the azathioprine is, it's an anti-rejection medicine, and it took the place of the Cellcept, and now I just take it every day. And that's what it looks like. It's not a very big pill. Most transplant pills are not very big, which I like because again, as a CFer, I hated swallowing pills. So that to me was a huge relief. But at the same time, I did take a lot of liquids at first because just the sheer quantity of pills that you have to take was very overwhelming to me. And I never liked taking pills. Like I've said before in other videos, I tended to skip pills just because I hated swallowing pills. So now, obviously, I can't do that. So I started off with any medication that could be taken in a liquid form, I would do it in a liquid form. And then I slowly started swallowing more pills and more pills. And now I can actually swallow all the pills that I'll show you by the end of this video in about 2 or 3 swallows. I used to be able to swallow all the pills in one swallow, but more pills have since been added and I don't like gagging on medicine. Anyway, this next one is called Rapamune. And it is an anti-rejection medication, and I take, so this is another one that varies day to day. So today is Wednesday, so I take 2 of these. Let me show you what it looks like. Again, it's not a very big medicine. So there it is. So I take 2. And so the way that I take it is on Mondays, Wednesdays, and Fridays, I take 2, and all the other days I take 1. And again, this is one of those meds, just like tacrolimus, that the dosage is determined by the level of it in your blood. So again, when you get put on tacrolimus, Cellcept is also, by the way, I don't take it, but Cellcept is also determined, the dosage is determined by the level of it in your blood. So again, it's a blood test based one, as is Rapamune. Luckily, they can draw it all at the same time and get all the levels all together. Okay, so the next one is azithromycin. This is probably something that a lot of CF patients are familiar with. And this is another one that I take on certain days only. So this is 3 times a week, and I take it Monday, Wednesdays, and Fridays. The only difference with this azithromycin versus the one that CF patients are used to is that this is the low dose one. This is the 250 milligram one, which I don't think most CF patients are on. Most CF patients do the 500 milligram one, I think. So this is what that looks like. It's a pretty small pill. I think it's about maybe half to a quarter or 3/4 of the size of the one that CF patients are used to. So today is Wednesday, so I am going to be taking that one. And I think we're coming to the end of it, actually. Yep, that's it. That's all I have. I do sometimes have trouble sleeping, so sometimes before bed, I will take a diphenhydramine. And I actually cut them all into halves because a lot of times I don't need the whole thing. Half of one will relax me enough where I'm not like thinking 100 miles an hour and I can sleep. And what I like about it is that it's over the counter. It's just Benadryl. And I get the really small dose, and I can, by cutting it in half, I have control over how much I take. A full pill will put me to sleep within about 10 minutes. So on nights when I absolutely need to get some sleep, or if I haven't slept well the night before, or if I'm just too excited to fall asleep, I will take the diphenhydramine. And actually this is in a different bottle because I don't like the bottles that they come in, so I put them in a different bottle and label it on the cap. That's the other thing I should mention, is that all of my medications, I write down the name, or at least part of their name, on the top of the pill bottle so that I don't have to read every single label, because that gets really cumbersome and annoying to me. Again, this is just how I do my pills. I know everyone has different ways of doing them. As a CFer, I'm sure you've developed your own methods, your own schedules, your own everything, and that will absolutely be very helpful to you when you have a transplant or if you've already had a transplant. So these are the pills, the morning pills that I'm going to take today. Let me see if I can show you these without dropping them. There we go. And like I said, I will take these in about 2 or 3 swallows. I usually do 3 swallows just because it's easier for me. And that's about it. If you have any questions, please feel free to contact me, and you can either email me in the email provided below, or you can reach out to me through Instagram. It is CF Express for Kids. And if you'd like more videos like this, where I give you an in-depth look into my post-transplant life, please give this video a thumbs up. And I'm also open to video requests. So if you have any burning questions, if you have an idea for a video that you would like to have me do, please let me know. I am here to help. I am here to help anyone who is interested in a transplant, is too afraid to talk about transplant, or is just someone who knows someone who's had a transplant and maybe you would like to be of help and support to them. Again, my name is Annette, and I hope this video has been helpful. And if you are someone who is thinking about transplant, or if your doctors have started talking to you about transplant, I really hope that this video will somehow calm your nerves and help you to have a more informed conversation about it. All right, thanks for watching, and I will see you in the next video. Bye now.